s'il vous plaît.
Page is that?
So let's see what we remember.
What page is that?
Okay? Let's see what you know after all this period of time.
38.
Okay. A little bit of review. We will be. I want to talk about synergists and antagonists of the shoulder complex, the arm.
Oh, that one.
Muscles that work. What are synergists?
They are muscles that work together.
Right. And how do you see them when there's a listing? of-
Italicized.
Thank you. Okay.
I knew that.
Holy crap.
Yeah, I don't want to give you all the answers. But I don't know why. But, well, no, I do know why. I was preparing for this tonight. I had some troubles with one of the joints, defining it. So I thought, well, let's go back over the joints to start. Let's see what you know. And what you don't know will help you figure out what you need to know. And we'll go around. Let's see. Okay, we have well, what are the types of joints to begin with? I'll go through.
Synovial.
All right.
Ball socket.
Okay, so let's focus on the synovial, aka diaphragmatic joints. Okay. So what are the types of joints? Name one.
Ball and socket.
Okay, ball and socket. Where do we find them and what are they called?
Hip and shoulder.
All right. What give you the anatomical name? Let's move around.
Good, because that's
Rather
all I
than
know.
calling out, I don't know really, because what happens, I'm noticing, of course, is
Sorry.
that the same people seem to answer, and you know, I've been there too. It's hard not to answer if you know the
I
answer,
know it all, I'm sorry.
but, and I'm not testing you, you know, I'm not saying, oh, you don't know this.
No,
I'm just,
Good.
so let's just
Spreading the
move
wealth.
around the room and let things flow a little better, okay? Okay, so, what's the name of one of those two joints? I don't care if you're using your notes or whatever as we go on. Glenohumeral joint, and where is that found? What does it consist of? Okay, so what is that? What are the two parts that are articulating? The glenohumeral joint is
It's the glenoid fossa
it's the glenoid fossa articulating
what part of the
Humerus.
humerus? What part of the
what part of the humerus?
The greater tubercle, I think.
No, the head of the humerus,
The
the
head.
ball, it's the ball. The greater tubercle is out here, right?
So the
The
ball.
lesser tubercle, the ball, the ball and socket. The socket is the glenoid fossa, which has this labrum that I may at some point be able to show you that kind of extends the
Is it
socket.
labrum or labrum?
Labrum, I'm sorry, thank you. Labrum.
No,
I mispronounced. So, I hope this is recording. They have it back there. I promise you that I will do it. Well, I do it. Right, I just don't know how well it works. It doesn't stay attached to me. Okay, and what's the other one? The other, and we know we have two. Where's the other one? What's it called? The other ball and socket joint. Okay. Okay, the hip, but what is it? That's a common name. So what do we call it? What's our scientific name?
That thing.
That thing.
Radial ulnar? No.
No, we're talking about the hip.
Okay, time. All right, you're out. Next.
You're out.
Unique.
Strike.
What do we call that hip joint? What's the technical name? What's articulating with what? Okay, it's a coxal joint. Okay, that's good. Okay. No, coxal. C-O-X-A-L. I could write that down if you want me to write stuff down. I can. We're not there yet.
Oxcoxal.
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 Oxcoxal. So what's another term for it would be what? What's articulating? There's a number,
So femoral?
right? It could be the coxal femoral, right? It could be the
That's what we do.
What?
Let me tell you, most medical people call it the acetabular-femoral.
exactly, and that's
Never
how
heard
I
of
learned it
femoral
because it's the
now.
acetabulum, which is that socket,
The hell is
right? Articulating with the what part of the femur? What's the ball?
Femur.
The what? Same as the part of the humerus. What's that ball called?
The head.
The head of the femur. Okay. The acetabular femoral joint. I know.
So the acetabulum is
like
also a fossa
That's the what's a deep fossa. That's right.
It's a
That's right. It's a
fossa.
socket.
on the ilium?
Right. It's because it's the ilio. Another term would be iliofemoral joint. Okay, so there's lots of terms, and you could see them in any number of ways come the state board, which is why I want you to know different ways of referring. Okay.
So were you calling that, you were calling that a faucet though, right?
No, he called it, it's a socket. I don't know, it's a
Oh.
deep, is it a fossa?
No, it's not.
No, it's a, the head would be a process, I suppose, right?
But in the glenoid, it's a faucet, the glenoid
Yeah.
faucet.
So it's the
So
acetabulum,
why wouldn't it be also a?
A
It's a-
faucet is like a depression.
right, but it's just
And
a
that's what
deep
the bulb
depression.
is,
Now,
the
I'm
bulb
not
is in
sure.
depression.
It's, the head's sitting inside, the
Okay.
ball's sitting inside that
Then maybe not.
cup.
See, your scapula is like a faucet.
Right, it's a shallower, we think of the fossa as something shallower. I'd have to look it up, sorry, don't have
I'll
all
look
the
it up
answers.
right
Yeah,
now.
there we go, this is one thing I love these smart devices for. Okay, all right, let's talk about hinge joints, okay? Let's name a few. What a,
Elbow.
elbow, okay, give me the technical name. No, Gleno's up here. Okay, Gleno. Okay, we're working our way down. Okay, well, there's that region is called cubital, right? So this is, the front of it is, what's in front?
The anterior-
Anti-cubital,
anterior-
right? Right? And what's behind it? Don't know. Anyway, so what is what is articulating there? Because somebody's not going to say the elbow joint on.
Why
Several
not? Why
joints, I mean,
not?
Okay, how many joints do we have there?
It's like
That's
four.
the humerotibial, right? That's the humerotibial.
Well, no, they're not four.
It's two.
Two, what's articulating? What? Bones, right? When we're talking about joints, we're talking about bones articulating. So what's articulating? What bones are articulating?
The owner.
You got the humeral radial
The
The
human.
humeral, well, the humeral, yeah, the humeral radial joint.
and the ulnar.
And
Humeral.
the
ulnar.
humeral ulnar joint.
And then when the ulnar meets the humerus, I mean, when the ulnar meets the radius, that's considered another joint?
Yes,
Or
but
the
not of
touch?
the elbow,
Humeral ulnar.
okay?
Okay,
All right,
Okay,
that would be next, but that's not a hinge joint, okay? I want to focus
That's
on,
the two,
let's
yeah.
stay, let's make sure we know
right,
what these
so-
are, and then we're going to talk about, I think we can get through it. Then we're going to talk about synergists and
So is it both
antagonists.
the humeroradial and ulnar?
Say again?
Humero.
Yeah, they're both,
and
because they're
humeral-
both articulating with the humerus. The radius and the ulnar are both articulating.
Oh, man.
So
right.
there's
Two-
two different ball and socket joints.
No, this is
No.
not, no, this is a hinge.
Yeah,
The hinge is, yeah, in two places, that's right.
So they raise your neck.
Like a double hinge, for instance, yeah. Okay.
It's an extension. Why is it an extension?
And that's right, what does it do? Good question, thank you. It flexes and extends. So it's simple, right? It's what axis, therefore it's what kind of axial? It's
One.
uni
Uni.
axis.
And it's in the what?
Sorry? So, okay, if it's uniaxial, it's moving through what plane?
sagittal.
Sagittal plane, and the axis is
Reverse.
mediolateral, right? Because the axis is perpendicular to the movement.
Okay.
That's how I stick a pin through the axis, and that's how I figure out the what it is. It's moving from medial to lateral. That's what the hinge operates on. Okay. Make sense?
Get over here, book.
Yeah, this is not a test. I thought about making a quiz, but let's have more
Oh my
fun.
God.
Let's all be involved here.
Finally feel-
Okay, not privately, but in a discussion. Let's see where we can go with this. What other hinge joints? Let's work our way. Let's stick with the upper extremities. What hinge joint? I know you have all some of the answers. Who wants to go? Can you give me an example of another hinge joint in the upper extremities? Where do I find them? No? Okay, anybody? Let's work our way back. Maria. Sorry?
Let's do this.
There's, well, okay, but,
Wrist.
Oh, your wrist.
yeah, for the wrist.
Radiocarpal joint.
Radiocarpal.
Radiocarpal,
That is how.
there,
But it can do more than one.
it's considered, because it's got more than just the hinge, right? The radiocarpal gives you not just flexion and extension, right? What else can you do with the wrist, right?
Deviation.
Right, the radial, right? So that is an ellipsoidal joint. And it depends on what books you look at. Some books will tell you that you have
Well, damn.
2 saddle joints in the body. Right? Well, that's one way of looking at it. But one of, I grew up, or at least I came of age being told that we'll get to that, the SC joint, it's a saddle joint. Some other places, let's see. But I've since would maintain that it's more of a
Bless. Thank you.
gliding joint, because it moves around in a number of axes.
Teamwork. If you want to
Okay, let's see, what other hinge joints?
Up here.
We're moving into, okay,
This one and this one.
we're nodding yes. Okay, but we've got some
You have
lateral
no plane.
flexion there too, right? So if we're dealing with,
Your phalanges.
your phalanges, exactly, your IP joints, right? Okay.
Oh, we're still doing the,
Upper
Hinges,
body.
we're trying to come up with
Okay.
hinges. Oh, well, the IP joints, upper body or lower body, toes or fingers. Okay, let's see, what about, whether it's your proximal IP or your distal IP, we know how to refer to them, right? Let's see.
So to answer your question about the fossa,
Oh, yeah, go ahead, please.
the deep part of the acetabular does it take part in articulation is known as the acetabular fossa.
There we go.
it is a
Thank you.
fossa.
Super.
Say that,
Okay,
wait,
so
can you
it's a
explain
deep,
that to
it's
me?
the acetabular fossa. In other words, the cup.
Oh,
Right.
right.
It's
The
not that-
ilium.
The part
It's a
that doesn't
fossa also, even though it's
place
deep.
the part in articulation.
So it's more than a little dip, but it's a fossa.
Oh, it's very deep. This
It's
is,
a cavern.
yeah. The shoulder is often dislocated, the hip, not so. You've got a lot of things to hold this
A
together.
tavern? No, cavern.
Cavern.
For some reason, I thought tavern.
So you gotta think it out the whole again.
Yeah.
A glenoid fossa, yeah, that's what it's called. So this is the acetabulum, AKA the acetabular fossa.
But the sits muscles hold this in.
Yeah, and
But is there a band of muscles that
Oh.
also hold that in, or
Yes.
just the
yeah, you've
fact
got, oh, sure, yeah, you'll see. And ligaments to restrict the
Both
ovary.
muscles that hold the
Yeah,
shoulder.
yep, which will,
12 that hold the shoulder in ball and socket.
Well, I mean, but basically they call it the sits, that one of the things.
The
that
four
says-
rotator cuff muscles are the the main ones that hold it all together. They're really little, but they are very important, but there's a structure that holds it all together.
Well, what about for the hip?
Oh, I
See,
don't know about the hip.
yeah,
I
we'll
just
get to
had
that,
shoulder
yeah,
surgery,
there's-
not hip surgery, sorry.
there's definitely, say again, what'd you say?
I said I only had shoulder surgery, not hip surgery. so I don't know anything
Right,
about
you
hip.
know everything there is to know about shoulder surgery. That is
Bring
funny.
my films,
Uh,
Robert.
Well, I remember I wanted the guy I sought
Pictures.
help from 11, 12, 13, before I moved down here, so 2000 maybe, for my sore shoulder,
Easy for you to
wanted to
say.
cut. You know, he's a surgeon. Oh, yeah, look at all this deterioration. We have. I said, no, thank you. I got massage and I got acupuncture, and I'm not saying that I don't have issues there, and some of it may stem from other surgeries, but no thanks. If you can avoid the surgery, do so. Sometimes it can't be avoided.
Can't.
No, I know, absolutely.
And your shoulders.
Thank
will be
heavens,
here.
you
Can't.
thank heavens that we have the modern medicine. I don't knock it. I've taken good advantage of it.
Last night I was feeling a great deal of shoulder pain, so Elena got a hold of me. She really straightened me out.
Good.
Just amazing.
Beat you to a pulp.
It's my new hero.
Okay. Let's see. Oh, the joint that we talk with, this is a hinge.
Temporal
Huh?
mandibular joint.
Huh? Mandible. TMJ?
Yes.
Temporal.
Now, it does have some other, it's got some
Temporal
sideways,
mandibular,
and it can
The most
contract
often
and
used.
retract,
Yes.
but it's all, I think it's considered a,
It's definitely the most often used for me, 'cause I don't shut
maybe it's a modified hinge.
Joint?
Not all it's so-
It's not a bone
No, it's not
socket.
a Vitsoil. No, there are only 4 bone socket joints in the whole body. Right?
What? Oh,
4.
shoulder,
right.
shoulder, hip, hip.
To
Right, gotcha. I was like, oh yeah, they're on both sides.
I don't want to spend too much time on this because I really want to focus on the muscles and see what.
But I
No.
like this.
And this is actually.
I'm going to do the muscles in the same way. Okay? Yeah, this makes. I've been beating myself. No, I try not to beat myself up, but I want more engagement than.
How about that
for example, last night?
Yeah.
And in general, when I can do it. So I can't promise to do it every night. We're not always at our 100% best, but today I'm.
So the TMJ would be.
Whatever. TMJ, yeah, I've got a list, that and again, it's going to vary from book to book.
Right.
So nobody is God. Nobody I've met.
When you dislocate your jaw, now that pops out of the occipital, is that like, it's a semi-bone socket, is it?
No, it's not a ball.
No.
At all. There's a disc in there. When I do.
But it's a small depression with the mandibular.
Well,
with
the mandible
occipital-
is hinging with the
occipital bone.
with the maxilla, right?
Okay.
Okay. And in addition, there's a little disc in there. If you work that really slowly, which is a craniosacral technique, you can actually get it to move back and down and open up. And you can feel it opening and sliding into the disc. Anyway, let's move on and name a few more.
Are sutures considered joints?
Yes, but not what kind of joints are they? Rather than I'll tell you what they're not.
They're not movable. They don't
Right,
move.
so they're not, what's the term
Synarthrotic?
for, are they synarthrotic or are they
Amphitheater.
amphiarthrotic?
Some people believe that they do move, right?
Yeah,
They
yeah,
actually do
they-
move for when you're doing.
So when
It
you're
depends, it depends on, because the craniosacral people tell you they definitely move, right? But for all intents and purposes, these fibrous joints here are considered synarthrotic, I believe are considered synarthrotic, right? Is that what our list tells us? And there's one other synarthrotic joint,
What is argomaticus?
the gomposis, right, with your teeth.
Gomposis and syndesmosis?
And what? Syndesmosis, it's a fibrous gomposis, the sutures. I'm not sure what syndesmosis means, but for all intents and purposes, it's synarthrotic.
Can you take a look at this for a
Alright.
second?
Yes, sure.
See that?
I know it looks like a ball, but
It's-
it's not.
it's-
There's
they-
a
they
little-
call it a
there is-
fossa.
It is a
Temporal.
fossa, yeah. But it's not a
It's-
ball
okay.
that's fitting into it. Okay.
No, sure looks like one, but anyway.
Yeah, it does.
Yeah.
Okay.
Okay.
Similar but
It
different.
gives me an example. They're medial radial ulnar and medial tibiofibular joints. So it's just
Well,
usual,
okay,
there's
yeah.
usual sutures that are in the bone that are held together. Right.
Medial, radial, ulnar.
And
Yeah, I guess you consider those to be.
What are
synarthrotic.
sutures exactly anyways? I mean, I kind of get where they are and all that, but I don't really know what a suture is.
They are where remember, joints are articulations of bones, right? So the sutures are found in the skull, right? Where the frontal bone, where all the the parietal bones, the temporal
Parietal
bone, where
suture,
everything.
And the lamboid, don't forget the
The
lamboid.
lamboid suture, which one is that? That's back, that's at the top of the
Of the occipital.
occipital, right?
Right.
So that's the articulation between the occipital.
Joints are there to be held in place.
Yeah, I know where they are.
Oh.
I
Yeah.
just want to know like what.
And they look like,
So,
these little,
When a child is born, your head You know, that's
That's what I was thinking of.
One of the things, exactly, they are very movable upon,
That's why you don't want to hit a child on the head
or stick your finger through the fontanelle,
That's right.
which is that soft spot in the middle, which takes, I don't know, a couple of months or years to really fully.
Yeah.
And what that enables, because the head of the infant is movable, the sutures are movable, going down through the birth canal, they could come out with cone heads.
Yeah.
They really can get compressed,
Yeah.
but it's designed that way. It all comes back together.
So a suture can be called a joint?
Oh yeah, it is
It
a
is a
joint.
joint.
But it's not a.
It's a type of joint, but it's not diarthrotic. It's not a synovial joint,
Yeah.
It moves,
right?
but it's not.
It's barely, again, it's considered
You can't consider it
synarthrotic,
cream.
but
Right.
those of us who do, and anybody who does craniosacral therapy, has got to believe that there's a certain amount of movement.
When you were born.
Why
Okay?
wouldn't it be considered?
They are not like.
I was thinking that
Partially
more sense
movable.
thinking about a baby.
Because when they
No, they move.
established
They are
these
not
categories
close
way back when, they
altogether.
just said these
They
don't
move
move.
and they.
Okay.
After you're born. and-
Before-
Right, other than at
Going
birth,
through the
maybe.
canal.
Okay?
It moves really shaky right away and then start.
They move when you
getting
grow.
like
Let's see.
Learn.
Like 6 months.
What about pivot joints? How many pivot joints do we have in the body? Let's see, anybody?
What did you ask?
How many pivot joints do we have in the body? Pivot.
Yeah, atlanto-occipital is one. Is that considered one?
Sorry?
Yeah,
Atlanto-occipital.
atlanto-occipital
Right,
is
right.
one.
That is our, what does it do?
And Atlantio.
That's our no.
Yes.
No, the occipital is yes.
No, you're right. The occipital is yes.
The axial is no.
atlanto-axial joint,
Is no.
right,
Right.
is no. Okay? What other, there's another pivot joint in the body, and we don't generally think of. Where would we find it? I'll give you a hint. It's found on the upper extremities somewhere.
The upper extremities.
Upper.
It's a
Right, it
pivot.
enables us to
Pronate.
pronate and supinate. Pronate and supinate. Right? There's a little pivot joint. I think it's they consider it the proximal. I've always thought they're proximal and radial ulnar joints. Right? You definitely see it. Let me see if I can dig it up here.
So it's both of them?
Well, it depends on the source that you look at. Let me see if I can find it in here. I want to show you the bones.
The distal one is near the carpal.
Sticking it in.
I'm like,
Well, it does make sense because.
I said she's not here. I'll talk to her.
She has some billion.
I don't know why she doesn't.
Right? They consider the joint to be here at the proximal end. Right? Right here's the radius.
The two bones are articulated.
There's the radius. But they articulate at both ends, and there's an interosseous membrane in here. Right?
Right.
That's considered, what did we consider that to be? Amphiarthrotic?
Which one?
The interosseous membrane.
Oh.
Because there's a membrane, you don't see it. It's not air between the two. Anyway. Not at all.
Membrane and most.
Huh?
Membrane and most.
I told her.
Yeah, membrane, right. There's a membrane and
Yeah, but
let's see, for example,
that's what I said.
White.
right? There's no air, but there's interosseous membrane that works off of.
I didn't.
Okay, where am I?
Peter,
Yes.
can I just tell you that Natalie texted me to she asked me to tell her sister that she's sick, or she's not here.
Okay. Thanks. Yes, okay. Now I have to remember that she texted you. She should text me. Okay, I'm the one. Now I have to remember that she texted you. I don't have record of it on my phone. This carries everything. Heaven forbid I lose this. Well, it must be somewhere in the
All I
cloud.
can say is
Enough of it, I hope. Is my calendar somewhere else? I think so.
You don't have a backup?
no, I don't bet.
I'm not going to worry about that now.
Unless you download it. Physically download it.
My son's like the cloud.
But if they synchronize, right? If you have a synchronization program, right? Let's not go there. Come on, we got to talk about other things.
All right, so
It's gonna take you for
the
days,
radio, so
weeks,
both of the
months.
radio, the proximal and distal radio.
I think of it that way. Some people will say no, there's only a pivot joint at the proximal end of the radial ulnar joint. Okay. Let's see. Any other? Okay, now we've got some ellipsoidal joints. Ellipsoidal that are going to be found.
Ellipsoidal, on the lips, just kidding.
We decided that was the wrist.
The radial, between the radius and the carpals, the radial carpal joint.
And did we decide the neck was also, or?
I don't know. Wait, I don't know where the ellipsoidal joints are. Where are they at?
Yeah, the occipital joint is definitely,
No, that's a pivot joint.
no, no, the atlantoaxial joint is
It's pivot.
pivot.
Atlantic is a hinge.
Occipital is something of a modified hinge. You could call it ellipsoidal.
She
Some people will
absolutely
call it
called it a hinge.
ellipsoidal. Some people will say it's a modified hinge,
Yeah.
right? So again, I just,
Can it be both?
Depends on who you're
depends
reading.
on who is your
You read.
authority, right? Where did this come from? I
So
don't-
right now you're it.
Yeah, right.
Sandra called it a hinge, the occipital, atlanto-occipital.
Yeah.
But
I
whatever.
think of it as a modified hinge, if not an ellipsoidal joint. And anyhow, that's our yes, right? Okay, we got some, I can't do much lateral flexion, but, let's see, what else? Oh, gliding joints. We've got gliding joints all over the place, and some people will argue that the gliding joint here, the SC, aka this, what's the
It's sternoclavicular.
sternoclavicular joint is,
C, SC and sternoclavicular.
That's one point.
There it is.
that's, I mean, there's a lot of movement going on there, right? Right? Some people maintain it's a gliding joint, some people maintain that it's actually your second saddle joint in the body.
Other than thumb,
The,
the hitchhiker.
right,
Gliding does-
Not the hip hiker, the hitchhiker.
okay, let's see, what else? What's the AC joint? What is that? What does it stand for, first of all?
No,
Acromioclavicular.
Acromioclavicular. Acromioclavicular.
Okay.
So the clavicle meets the
Right, that's
acromion.
where the,
Isn't your AC joint also in your knee?
no, that's it. That's
ACL?
ACL.
Oh,
That's a
ACL.
ligament. That's
That's a
the
Sorry.
anterior collateral ligament.
Cruciate.
Cruciate. I'm sorry.
Yeah, the
This
lateral's
glass
on the side.
Yeah, I know. But just,
It's what?
it's the one that they're always,
During a football.
Class.
football,
Well,
basketball.
actually, the lateral is the one
Lateral is the one. So the basketball must be the ACL.
skiers.
So where's the AC exactly? Is it like right here, or kind of like here?
The acromion clavicular joint is where the, see, this is why I need this bloody,
Because I have
Skeleton.
This, I have this.
where's
right
your
here.
box of bones?
Here.
I got,
So you're,
in
I
there.
think it's like right in between.
But I ain't going in there
Yeah, but
because I
see what, you don't see the
big
full
fat
thing, but that's,
Yeah.
it's, here's the clavicle, right? So where the clavicle articulates with the scapula.
Would you want to blow this up? Do you want to put this on here, blow it up that way?
sir,
I have a blank one.
this is a lot clearer.
Yeah, let's put
There
this
you
up.
You
go.
can blow that one out.
This is great. I'll just put it right on.
Much clearer.
I was born in the.
Let's take it.
Ooh, that's my handwriting.
Oh, we need a screen.
It's better than the book's text.
Yeah, definitely.
I put my hand.
Yeah, right.
Okay.
Oh yeah. So that joint is like right here.
Yeah. This is the,
Okay. So the acromion, right? Not the bird's beak. That's the, what's the bird's beak
This.
called?
The something process.
Coracoid process, right?
it might be
I don't know
joined
where
together
the
with
coracoid
the
means bird in Latin. I don't know where that came from. All right, and what is the? There's another joint that's not technically an anatomic joint, because if we maintain that anatomic joints are between bones, right? Right? But there is a joint that's functional, if not structural, involving the scapula, and what is that called?
Costal?
Well,
Ribs.
no, that's
What was
costal.
the question?
Okay,
Yes,
there's
it is.
another joint, right? Another scapular joint, right?
Sternoclavicle?
No, not sterno,
Another
it's
scapu-
scapula.
That what?
SC, what's it, it's articulating, the scapula.
Correct. Ah,
Because it's not, again, it's not the
Scapulothoracic?
bone.
Thoracic?
It's not the scapula again.
Scapulothoracic?
The scapulothoracic bone, right?
That's listed
It's-
as not a true joint.
It's not a true joint. I mean, the
Is that here in
scapulothoracic
front?
joint. But what did I do with my pages here? It is, some people call it the SCT, right? S lowercase c. The SCT, right, as in scapular thoracic, as opposed to,
Scapulothoracic artery.
right? So it's a functional joint, it's the fascia, it's the muscle, right? Underneath, you don't, there's,
It's that posterior
yeah, of course, yeah, it's
Yeah.
posterior.
on that
But the
side.
joint, so you don't actually, you won't actually see the joint here because
Yeah,
the
it's-
bones are not, it's not the scapula itself that's articulating,
right.
right? But the muscle, the fascia, I mean, it's all is, everything is connected back there.
Right.
It's motion, it's not an anatomic joint, but motion, because motion can't occur without the other, the SC and the AC, right? The sternoclavicular here and the acromioclavicular joint without their moving. Okay, let's see. What are the joint movements of the scapula? Talking about scapular,
rotation.
okay, rotation. What kind of rotation? Gets
Circular?
No, it's
Diane, you're on a roll.
okay. Let's.
or lateral.
Hyperextension.
There's, well, what they call is, they call it upward rotation and downward rotation.
Elevation and
It's very similar to elevation and depression, right? And looks a lot alike to me,
Well,
right?
how do you know the difference?
You look at a ton of YouTube videos and try and sort it out. That's what I've been
But
doing.
it's called scapular
No, but-
rotation.
Yeah, there's
Between
scapular,
rotation and
AKA
elevation.
upward rotation.
Because you'll see.
Okay, and what I'm going to do, I want to talk about all of these motions and the muscles that are accompanying
And
them.
then we go.
But as far as the scapula and the clavicle, we know move together, right? One cannot move independently of the other, right?
Who's turning the
It's
pages?
Sandra.
What's that?
Ah, so the
Ah.
the page.
No, the page
going-
kind of flipped.
page
Who's turning the
The
page?
Broward College ghost.
He's like, who's turning the page?
Well, let's see what else we can.
You were doing too much Reiki.
Well, let's move on because I want to talk about the. Yeah, we've got some nice things going on. It's too bad this thing isn't. Oh, it is adjustable. Look at that. That's maybe better.
That guy's got a
Well, what
clock in
is
his
the, all
back.
right, joint movements of the scapula? We know we have
Elevation, depression.
depression, right? Protraction,
Retraction.
retraction, okay? And then you've got this, it's weird, upward rotation.
Shrug action.
Downward. Well, it's
But
not
don't
a
you
shrug, a
have
shrug is, the rotation involves that, exactly.
But don't you have
That's, and it can happen individually. So for all intents and purposes, upward rotation, let me see, I've got my
Is
notes
it
here.
hyperextension?
No, it's not, no, it's,
What
you're talking about, essentially, you're abducting and you're adducting when you're doing that upward and downward rotation,
But are we talking
as
about-
I understand it. Let me see,
I don't think the scapular hair.
what's that? Hyper-rotate, no,
I don't think the
no.
scapular
No.
hair hyper.
It can't it's not extending, yeah.
That's a good thing.
No, well, you've got I suppose if you have a weak serratus, oops, what happens? What can the scapula do? It can it can certainly hyper do something, right? It can become something like a wing if stratus anterior are weak. Right? Remember that, please? All right, let me move on to the muscles that are involved here. Well, wait, let's just cover the shoulder joint first, and then I'm going to really talk about and ask you how much you know in terms of synergists and antagonists for the
Nothing.
scapular, shoulder complex, and the arm. Okay,
I'm good.
good.
Yes, sir.
Yeah. This is the way to do it. That's when we can, and we will have time tonight to spend doing some Swedish. Doing it.
I got a quick
Sure.
question
Yeah.
for you.
Oh, yeah,
The
we're
pubic
gonna spend the
symphysis.
time, I wanna get my
Right, right.
massage, and we're gonna go down and get the oil, right, Diane?
Yeah.
Oh,
Good idea.
And somebody
it's
else.
time for another laundry. Who's going to go down?
Laundry.
Who can afford to go
I'll
down?
go down.
I will
Okay.
go, but I don't want to go by myself.
No, I want people going in pairs. I don't like just one
All right,
person.
I'll go.
Okay,
Let's go.
you know all the answers. No, you.
Yeah.
No, that's two. We're like, right
Oh,
there.
okay.
They're good. You're good.
I had a question for you
the 8 o'clock one. Yes, sure.
about the pubic symphysis. Can that be considered a suture as opposed to a joint?
No, it's a cartilaginous joint, right?
But there's the move. Well, actually, there is.
It's amphiarthritic. It's what enables
Yeah,
the woman's
okay.
hips to get wide enough for the vaginal
yeah.
opening.
All right. You,
Okay, the pubic, and of course the intervertebral discs. Okay, same sort of
Mhm.
cartilaginous
right.
joint.
Thank you.
You're welcome. Okay, joint movements of the shoulder. We know the name of it, right? We got the general glenohumeral, right? Okay, we know it's synovial, multiaxial, triaxial, or multiaxial, however you want to call it. So what movements does the shoulder? What is the shoulder joint? Oh, we know that. Okay, it's between the scapula and the humerus. Okay, so what are the movements? And do it.
Everything.
Right. What are
Depression. Oh, the
Right.
scap,
Shoulder.
the shoulder.
shoulder?
Flexion, extension.
Okay.
Rotation.
Abduction.
Abduction.
Adduction. No, wait.
AB is right, just straight up. Okay,
And
so
then
add
add.
is back.
Yes.
Yeah.
Okay, what other
Rotation.
Horizontal.
horizontal what?
Abduction.
Adduction and horizontal
Ab-
abduction and two more.
Protraction.
Protraction. and
No,
extension.
it's-
Rotation.
There's
Oh,
a
the shoulder.
rotation, right?
Talking
So
about
we're
shoulder?
medially
Yes.
rotating the shoulder. We're
Rotation.
turning the shoulder
Like
in,
from the scapula,
right?
shoulder.
And lateral rotation would be turning it
Turn
out.
on it.
Okay. Okay, so let's talk about it. Let's see. What muscle? We'll see what comes to mind at least. Or, let's, because I want to. No muscles work alone, right? Either you've got some helpers, right, or synergists, and at the very least, if you've got one muscle or muscle group working, that's your prime mover, your
It's locked.
right? What?
It's locked. We're good, aren't we? See how fast we work?
It's the door's locked. Excuse
No,
me.
the window. We tried the window. We tried to go in the window. No, just kidding.
Why did?
We should curse him out.
I can't do that. I'd like
I
to.
guess they figured.
You know when I went to the
But
boot
I
Call
wanna
your
get-
friend, your girlfriend, with her cart. She's got to have a key.
I would open it, but I want to get arrested.
There we go. Security.
I won't
press.
solve it.
Press 2.
It's illegal if you get caught, right?
That's right. That's what my son, when he's a cop, that's what he says. He says it all the time.
Hold on while I try that extension.
It's only illegal if you get caught.
Why would somebody come in and?
Hi, are you pizza guy?
Hi, pizza guy.
Yeah, there is a guy. I mean, let me know if you need more there, Roberto.
Yes, hi, it's Pete Fox, and I'm a massage therapy instructor. Somebody locked our laboratory 146 and 41. And we used both classrooms. It was open earlier. I don't understand why somebody would come in and lock it, but it's locked now. We need to get in there. Okay, thanks very much. Okay. Yeah, 146. Yeah, we're up in 206 in the classroom, but we will be down there, and we're doing laundry all the time, so we need to go back and forth. Okay? Thank you, and appreciate it. Okay, bye. Hey, you get more flies with honey than you do with a hammer.
Yes,
It's a fact. I mean,
Yes.
to start screaming at her and saying,
I agree.
forget about it. You know, it's not going to do me any good. So if I can charm her, I have to. I don't want to be obsequious, but I just
When I do
let her know there's the problem. Please don't do it again.
I usually ruin my day.
Right? Is it not going to happen again? I'm sure it's going to happen
As we
again.
visit the clients in the rest.
What can you do?
Oh,
Let's see.
grazie.
Who wants me now?
Yeah, she's okay.
I just got your text, Gemini. Thank you. Glad you made it. You missed a good hour so far. Are we going to pause here? Let's pause for a minute. Back on. I'm in the doghouse now. I forget I pause it and then, okay, well, we're back. We're back in the middle of a scapular discussion, scapular muscles. Okay, so what are the protractors and the retractors? And another term for scapular protraction would be, it's not a term that I generally use, but again, I've looked at a number of sources, would be scapular abduction, right? You're abducting it. You're moving it away from the midline, right? By going like this, coming back, you are retracting it.
Whatever.
Okay, so the retractors, I think we already know, right? Rhomboids, minor and major, right? In addition, what else? Remember we have 3 parts to the most superficial muscle on the back? The traps. So what part of the traps would also be retracting? The middle, exactly. That's where that's. Right? Just think about what the position is, and that way you'll know. You won't have to say, "Oh shit, I have to guess again." Pardon my French.
Oops.
Okay, we speak it too.
We speak, right?
So it's lower traps, pec minor, and
Mid-traps.
mid traps.
Well, mid traps. Again, this is for retraction, right?
Retract.
Right? Middle trapezius and the rhomboids are retracting, and for protracting, you've got pec minor. Also, and we know that it's a depressor, and you've got the serratus, big serratus, all those muscles here. The serratus anterior, they're pulling it forward. Okay? Remember, they're originating on the first 8 ribs, right? And they're inserting on the where? What are they inserting? Serratus anterior. Got to be on the scapula someplace, right? Got to be pulling it forward. All right, look it up.
Are they on the coracoid process?
Sorry?
Isn't it in your ribs? Where
Yeah, well, it's originating on the ribs, and it inserts on the anterior, the vertebral border of the scapula, right? Let's say the anterior aspect. That's what enables it to pull forward. Okay, let's see. So that takes care of protraction and retraction. I got 2 more pages, and then we'll have enough time to do some work downstairs.
Do we need to switch out the laundry now? You think?
Yes, let's see if
think it's
if-
unlocked?
I hope so. Try. Well, didn't you go already?
I went yesterday.
I'll go.
All right, go ahead. And if it's locked, I don't want to think about it. Okay, now here's I don't know why, but I always, and I find everybody I know, myself included, has a hard time comprehending upward rotation and downward rotation, right? So as I understand it, as best I understand it, as the humerus is abducted, right?
By the deltoid.
What's that?
deltoid descent.
Right, like so. It doesn't really matter what's happening here. We're talking about the humerus. That is upwardly rotating scapula. It's going like this, right? So it's, the scapula is moving out, and I think I may have it under the scapula here, and then I'll show you the, let's see. Well, I don't. I'll get it up there in a minute. Anyway, so downward rotation. All right. So what's moving? What's making this go upward? The scapula. I don't think of it. I never thought of this as being rotation, but it's rotating. The scapula is moving up.
Because you're like reaching, if you're reaching.
Yeah,
for
you're
something.
reaching for something. You're reaching
above.
over.
Don't
So
the lats kind
rotate.
of twist around and go to the humerus
I.
in the front?
Your lats do. So are they? I've never seen the lats listed as one of the that upward rotation of the scapula or downward rotation of the scapula. For this upper rotation, as the humerus is abducted, you're involving the upper and middle traps, right? Lifting up, right? You could feel it happening. Right? Palpate it on yourself as you're making this movement.
Is the supraspinatus involved in the movement at all?
No.
No.
No. That's abduction of the humerus, but the scapula is not moving there. So you got upper middle traps, and you also have the serratus anterior involving there. Downward rotation would be our rhomboids, again, even though we think of them as being retractors, and they are primarily. And again, I find it confusing. In addition would be levator scapula, because you're moving back down, and pec minor. Again, they're very similar to elevation and depression. Okay. All right, I've got to hand this back. Let's see. That finishes our scapula. Now we've got a shoulder joint. Let's talk about the muscles, the movements of the glenohumeral joint. Right? So we know we've got flexion, extension, abduction, right? Horizontal. Adduction, right? Horizontal abduction. And yeah, those are well, there are a few other things that, then we got, our rotations, right? Medial and lateral rotations, right? And again, that's not of the forearm, we're talking about the humerus. So let's look at the muscles that are involved. For flexion, right? And the flexors are all antagonists to the extensors. What's moving? What muscles are involved creating that action? The flexion of the glenohumeral joint. Okay. The biceps, absolutely. Biceps. Right?
The deltoids?
What deltoid? Yes, remember the deltoid has
3 parts.
3 parts.
Anterior.
So what's going to move it forward would be anterior. Exactly.
Okay.
Anterior deltoid, biceps brachii, and 2 more, as I see it. And I'll put it up there as soon as I finish the flexion and extension.
Are the trapezius involved at all in that movement?
No. This is moving from anterior. So you're going to be dealing with your pec major, right? For sure, your pec major. And probably the upper section, right? I guess the clavicular head of the pec major. And the coracobrachialis, that's one that might not come to mind, but that's involved there too. Great. Because it's, again, all these muscles are crossing this shoulder joint, the glenohumeral joint. Okay, extension, what's involved? What muscles?
Triceps.
Sorry?
The triceps.
The triceps, absolutely, right? remember there's, the triceps is also going to extend another joint, but we'll get to that. So the triceps, what else? A bunch of them. I list 1, 2, 3, 4, 5. Right. Posterior deltoid, exactly. Right? So the deltoid is an antagonist to itself. Right? To what?
To its own self.
Yeah, to itself. Really, it's kind of funny, but it's true. The posterior deltoid is an antagonist to the anterior deltoid. And they'll do some things together without a doubt. They're going to abduct together,
Yes.
right? Although they don't initiate abduction, that's done by what muscle?
The scapula,
No, but it's coming off the scapula. It's connecting to the same.
coracoid.
No. The
supra.
supraspinatus. Right, the supraspinatus.
But isn't that?
It was open, I take it? Yay.
No, it's FEMA.
Okay. We're talking about shoulder glenohumeral extensors. So we've got posterior deltoid, triceps.
Supraspinatus.
Sorry? What else? I count 3 more. Maybe, yeah, let's see.
For extension?
For extension, yeah. What's pulling back here? Remember, what is this?
Your lats.
Lats.
Finally.
Lats.
I was gonna say, finally, can I say?
Finally, the lats come into play. Yay.
Keep saying it, eventually it'll be
So
right.
nothing has happened to anything there?
What's that?
There is
Eventually it'll be
minor.
right.
Teres major definitely is involved there. Not minor, but major. Okay, pec major, teres major, triceps, latissimus dorsi without a doubt, and the posterior deltoid. Okay, let's see if I can throw this up on the screen.
Wait, that's something that
Oops.
Page 64 of,
Yep.
so you have.
Yeah, you got the book.
making sense.
I really think this is great, but I didn't want to put this up before
Right.
seeing what we know.
But it does show teres minor
And
also.
here you saw. Oh, it does show teres minor, yeah. Okay, let me make a note of that. Teres minor, I only listed
I
6.
was guessing.
Good. Teres major and minor. So I'll go to my computer and I'll update my notes for the next time, whatever. I find when I put together a list like this, it helps me like a study guide.
So that's a list that you made?
Yeah, I did this today. So, and I went through the book and said, all right, what are all the movements that we need to know and what are the muscles involved? And not every book will tell you the same muscles and some are more significant than others, but here we've got 7 and I only listed
You
6.
don't want to give us a copy of that later on, do you?
That would be.
Yeah, oh, stop by it. Oh, no, it's not
It's
necessary.
not in our syllabus.
Yeah, I know it's not in your syllabus. When I get
Book, but-
access to the printers here, and it's got to happen eventually. So I need to yeah. When that happens, hopefully sooner than later, I'll start making prints and stuff like this. Without a doubt, I'm more than happy to give you what I can.
This
The
book doesn't
handouts,
have all
because I think it's
It
a great,
doesn't have it
it's a
like
great
that.
book. But you've got, your coloring book.
Yeah,
is-
I've got some stuff.
Yeah. Okay.
Whatever.
So that gives us our extensors, our flexors here, right?
What is the green one?
Right, anterior deltoid, right?
This green book doesn't have it like that. Flexors of the humerus. flexors.
Really? What is, they don't break, they
It
give
names-
you 2 on 1 page is what they tend to do. They've condensed it, but they still list the
That's the
muscles.
same
Like-
book as the old version?
Yeah, this is
Oh, I
different.
guess
Yeah, they do, they
I guess
do.
they do.
They're just, they make it half the size.
I guess they do.
They
yeah.
put 2
Second Adams.
on 1
Spit on my
page. See, I
eyes.
have the flexors and extensors on 2 separate pages. The new edition has it on 1
Let me
page.
see how this.
The older edition, who knows?
The 5th edition.
But it's a great
still be
resource. Between us, we should get
You
copies
just
made.
memorize the whole book.
Under motions.
Really? Well, we certainly summarize the
Seven
different
motions.
joint movements, and therefore connect the muscles together with the
Upper extremity
joints that
motions.
they're moving.
Yes.
And that's where it is, in the scapulus, the humerus.
Okay. Now, we also have abduction, right? And adduction, right? So let's talk about, I come up with 2 abductors of the humerus, right? Sorry?
For the humors?
Yeah,
Ad or AB?
ab, not ad, abductors, right? Right, what's,
Take away, yeah.
right, taking it away, you're abducting someone, right? You're kidnapping the
I
arm,
just didn't know if he was saying.
right?
So it's gotta be shortening.
Actually, all the fibers of the deltoid working together. Because deltoid's a huge muscle there, and it does a lot of work. So in order to abduct, you need all the fibers can work together there, right? So they're complete.
Is this your book?
Sorry?
Supraspinatus.
And the supraspinatus, exactly. The deltoid follows, the supraspinatus initiates that abduction. Okay? Okay.
Don't put absent.
Let's see. Adduction or adduction.
Pec major.
Pec major, absolutely. What else? Because adduction, remember, you're pulling, you got a lot more pulling things down, even though you think, well, gravity can do
The
that.
lats.
Starting
Right, lats, without a doubt, right? A few more we could also list, the coracobrachialis, the
Teres
subscapularis, right?
Teres
Pulling.
major.
The teres major, without a doubt. Teres major, we can also argue teres minor and infraspinatus as well, all pulling down, right? Okay, so I can
Centers of the humerus.
show you that. Let's see. There's adduction, should be somewhere here. Here we go. Now here we got two on the page, right? The abductors, supraspinatus, and here they're calling middle deltoid. I see my source told me all the deltoid fibers. So it depends on who you want to believe. But certainly, when it comes to the state board, I don't think that's a good thing to say, right?
28 or 7.
Say, but Mr. Fox said. Okay. That's legible, it's readable, it's good. Okay.
You did one?
Yes.
I know.
So let's see what else we have. Oh, we've got. Remember, we have horizontal abduction and adduction. What are the muscles for that? Right.
The answers.
Oh, there's one muscle, primarily one muscle for abduction, for horizontal abduction. So it's what's pulling it back. The big one up here. It's a posterior deltoid. Posterior deltoid. Right. And that's your antagonist, remember, to the anterior deltoid. So horizontal adduction, of course, is going to be
Anterior.
the anterior deltoid, in addition to pec major. Okay? So is it starting to make a little more sense this way?
Oh, yeah.
So the abductors of the humerus, the supraspinatus and the middle deltoid, one of them a synergist?
I think they're working together. So they are synergists. They're prime movers. I mean, neither one is truly, I guess you could argue, one is a synergist to the other.
But neither one is subservient to the other.
No,
They're both,
no.
they're both
But
fine.
one can't, right, the deltoid can't initiate the movement. That has to come from up here. But their deltoids, they're huge muscle.
So are there synergists to those two?
No, I don't think so. And I consider all the deltoids, or all fibers of the deltoid, not just the middle deltoid, to be an abductor.
Maybe not horizontal, maybe.
No, not horizontal abduction, but true abduction
Right.
is all the fibers.
All fibers.
Yeah, yeah. Horizontal abduction, of course, is anterior, or rather, abduction is posterior. Adduction is anterior. Okay.
The other side?
Sorry?
The other side? No.
I don't think so. No,
No?
Adduction or?
no. Pec major.
Because he's saying adduction.
Yeah, and the anterior deltoid would be horizontal adduction. Let's see. What do you list anything else here? Oh, this is adduction. Let's see. Where's horizontal? Here we go.
Oh, I see it now, okay, so like in the flexors of the elbow, the pronator is a synergist, because it's.
Yes.
it's written
Yeah.
in italics.
Yeah.
I got it.
Okay. Yeah. So speaking of which, let's talk about. I'm going to work all the way down the arm. I'm not going to get into the wrist today. I'll get down to the. Let's just cover the elbow, flexors, extensors, the supinators, and the pronators, and then we'll go play. Okay.
Right.
Is it two? No, we've got plenty of time. What am I don't know what I'm in a rush for. I'll find a movie. I'm ready to stop here, I think.
God bless you.
Well, wait. So let's go with the elbow, aka forearm flexors and extensors. What are we dealing with? What muscles? What's flexing the forearm? In other words, the elbow joint.
Peter, are you done?
Yes, I'm done. Sorry. Thank you. Thank you very much. What muscles? There are four of them, right?
Biceps brachii.
Biceps brachii, without a doubt. Okay, what else?
What are we doing? Which one?
The elbow flexors. Biceps brachii.
Brachials?
Yum.
Your brachialis.
Brachialis, that is the strongest elbow flexor. Not the biceps, the brachialis.
It's stronger than the biceps?
Yes,
Really?
it's your strongest elbow flexor. And two more.
Pronator teres?
Pronator teres is a true synergist, without a doubt. So that's for you, Robert. Definitely a synergist, and you'll see it's in italics, right? In the book. Because essentially we think of it as a pronator, but it's also,
Brachioradialis?
and that brachioradialis, thank you.
I just knew it off the top of my head.
Did you? Not exactly. All right.
I read it right here.
All right, because I don't care how you get it here when it comes down
Right,
to
practicing, so.
exactly exam time, and with her study guides, hopefully it won't be too difficult. I don't know who's making
Just
this,
worried
but we'll
about
worry about that.
boards, that's
Okay,
what I wanted.
so what is or what are? Because there are two forearm extensors. Triceps brachii, without a doubt. But there's one other. There's a little.
Is that Anconius?
That Anconius.
Is that right?
Little Anconius. Yeah, you got it. Yeah, yep. Okay, that's definitely a synergist. Not a big deal. It's a synergist. Okay, pulling it back. By the way, we know when we're working on all of these, especially these hinge joints, depending on the position, but if someone's prone, we don't let the legs snap back because you can hyperextend the knee or even an elbow. Certainly, I've seen people come very close to hyperextending a knee, and you can do some serious damage if you're not holding it properly and you let it drop back when you're doing work. Okay, so we have supinators and pronators, right? And that's it. That's where we'll stop. And I was ready to stop there. So what are the supinators? Oh wait, should I throw up? Let me throw a.
Diane.
Well, the flexors. Here we go, right?
Ashley bought it. I was like, why'd she buy it? I hope she's using it.
So we got our flexors, right? Pronator teres is
I know.
a synergist. Anconius is a synergist here. Okay. There's your extensors and your flexors. Okay, supinators. What do we have? What are the two supinators?
One is the supinator.
The supinator, the one and only supinator, but there is another muscle that does supinate, right? Which is to say that it's turning the arm, and what is the name of that muscle?
Biceps brachii.
No, close. It's the biceps brachii.
You said that.
The biceps brachii is a major supinator. So I know it's a forearm flexor, right?
Which is the protagonist.
But the biceps brachii. And the pronators, two pronators, right? What are they called? Pronator this, pronator teres, right?
Quadratus.
And
Quadratus.
right, quadratus. Quadratus it's four-sided.
Cuatro.
It's here for
Quadratus, here we go. Quadratus is here, right? Number 2. Right, you see it?
What's the square?
Four-sided muscle.
pronate or quad?
Right, this is, right. Pronator quadratus, pronator teres. This is from the medial, let's see. Yeah, from the medial epicondyle, I believe, to the radius, and it then turns.
Where does the teres come from? What is the pronator
Teres.
teres?
tira.
Pronator teres, let's see.
Yo pensaba en Teresa.
Yo puse teres como una tira.
Here we go. Right? Teres is here, right? It's originating on the medioepicondyle, right? It also has an ulnar head, right? Somewhere starting in here.
Does.
Yeah.
And then it's inserting on the middle
Oh,
of the lateral shaft, right? Of the radius,
oh, the
right?
radius.
Which is why it's going to turn the radius, the middle of the lateral shaft, right? Here's our radius, right? It's coming across from the medioepicondyle, right? Here of the humerus, and it's crossing, right? To the middle of the radius,
You cannot get
So it's
and it's going to then pull and turn. And there's your pronation.
But it's diagonal fibers like the teres major and the teres minor.
Yes,
They also have
yeah.
diagonal fibers.
That's right, that's right. And here with the pronator quadratus, it's like a band on the bottom there,
Yeah.
right?
It's what, a year and a half?
Is it bad?
And it's pulling, again, the idea is the radius is being pulled across. It's pivoting on the ulna. And some people will say this, you've got a distal, well, this is your distal radial ulnar joint, whether or not it's a pivot. And here's your proximal radial ulnar joint, which is definitely a pivot joint. Okay? Does this help? Okay.
Yeah.
That's all I have planned for tonight. I shouldn't tell Mom that. But I think we've done a lot. Do you want to take a look at the forearm muscles down into the hand through with the use of the book, and then we'll go downstairs? Sure. Okay, sounds good to me. I thought I had that in mind. Let's see.
One day you should buy this book, it's a good book.
What's it?
You should buy this book, it's a good book.
I find this is really helpful because you see
You don't want to take it?
the nice thing about the
Yeah, buy it.
Yeah.
whatchamacallit, Segan Adams is there's very little extraneous information in there. It's easy to see the origins, the insertions. I love the trail guide, but sometimes there's too much information. It's on. Okay. So let's see. In any particular order, as we did yesterday, going down the arm.
About 6, 7.
I'm just going to work down. Let's start with the extensors. So if they're extensors, the view is posterior, right? I'm not going to, I turn here and show you there's my posterior. So I just kind of turn it around and imagine. And when I'm reading this stuff, I just work it myself, feel, well, what's moving? What do I see? What do I feel? When I'm looking for the extensor carpi, tells me what it's doing, right? It's extending the wrist, right? So if it's beginning somewhere on the humerus, right, which happens to be the lateral, supercondyle, whatever, lateral epicondyle, and it's inserting at the base, right, the base just below here of the second. First would be the thumb, second metacarpal. So what can it do? It's going to extend the wrist, carpi, and it can also, it's radial, so it's also, it can, or it is, a radial deviator. Sounds like a really terrible thing to be. You a radial deviator? A deviant?
Yeah.
Okay. Okay. So as it says, acting alone, this muscle extends the wrist in a radial direction. Whatever acts alone, very few muscles act alone. But this is one of the radial deviators, as well as a wrist extensor. Right. Don't ever. If anybody ever calls you a radial deviator,
It's an insult.
it's a serious insult.
Exactly.
Okay. What else? Extensor carpi radialis brevis. Okay, so the difference here is where it's inserting. Base of the third metacarpal. Same idea, right? It's an extensor on the radial side into the wrist, around this backside, posterior. So once again, this isn't going to be pulling to either side. It's in the middle, right? So it's only an extensor. Okay, what's next? I'm just turning the pages. Extensor carpi, all right? Carpi, we know, is the wrist, right? But the last word, ulnaris, tells us where it's going to be inserting. In this case, it's the pinky fingers, or the metacarpal, right? Right, because it's inserting at the base. See, here we're going from the lateral epicondyle. It's crossing to the radius and extending at the base of the 5th metacarpal, right? Which is the metacarpal below between the... Right? We all know what we're looking at? Makes sense? Yeah, of course. So this could also be a... do they consider it a... yeah, it's an ulnar deviator, right? It's an adductor, aka an ulnar deviator. Right? What's worse to be, a radio deviator or
Good recovery.
what's that?
The other one.
Be in recovery. Okay. All right, moving along, let's see. Flexor, now we're going into the other side of the wrist, right? Or the other side of the arm, forearm. Anything that's flexing is going to be found anterior, right?
Anything that's flexing.
Okay. On the forearm, right?
The upper extremity.
Okay. The upper extremity, and we know on the lower extremity it's just the opposite.
Right.
Okay. It's like, well, turn me around, but I wouldn't want to be walking ass forward.
You wouldn't want to be walking ass forward.
Sometimes it seems like we are, right?
Some people
Tell me
would
what their
go
head is up there. No, we don't want to go there. Okay, so flexor carpi ulnaris tells us the, starting from, where are we? The humeral medial epicondyle of the humerus, right? You've got an ulnar head as well. Here's your ulnar head here. Let's see, proximal, posterior ulna, and olecranon process of the ulna. We know where that is, right? The olecranon process is the, your funny bone, right? That fits into the olecranon fossa, right? Of the funny humerus, right? Right. That's one of the humeral ulnar joint. Right?
Right.
Okay. So in any case, you've got the humeral head and the ulnar head. And what are they doing? This is inserting. It's wrapping around. Let's see. It's starting posterior, it wraps around, and it's coming across. Let's see.
Flexor carpi urinary.
It's flexing. It's inserting on the two carpals, right? The pisiform and the hamate. You could see them here. 1, 2. I could use this pointer. Right? Right? Pisiform and the hamate. And the base of the fifth metacarpal, not phalange, but metacarpal. Okay, so what do? They flex the wrist, and in addition, flexor carpi ulnaris and extensor carpi ulnaris, which we'll get to, or did we get there? Remember this one? Okay. Together, since again they're on the ulnar side, they're going to adduct the wrist. Right? So they work together. Now one is a flexor, one is an extensor, but they're both pulling in a medial, right, ulnar direction. So they are ulnar deviators, or what else? What do we call them? adductors, right? Flexors. Well, this one is a flexor. But together, this works with the radiocarpi ulnaris, or rather the extensor carpi ulnaris, to adduct. Okay? Okay, let's see. What else? Palmaris longus. I don't know. How far do I want to go?
That's the longest.
All right, well, let's go with palmaris longus, okay? Here, you've got 4 connections here, right? Beginning from the medial epicondyle of the humerus, inserting on the palm, right? The palmar aponeurosis.
That's on this side.
Right? Yes, palmar side, right? And the flexor retinaculum. So it's a wrist flexor, right? Let's see. Oh, this, by the way, it's a long tendon. I made a note of this. It's sometimes they just cut this sucker right out. You don't need it. You've got others, and they use it for other repairs in the body. And in some cases, it's even not. It's absent on one or both sides. You may be. Some of us may be without them.
Is that the review?
So it's clearly not critical. It's not like you got a an important heart valve or something. Okay. They don't talk about, well, they do mention palmaris brevis. We don't have to worry too much about it. May or may not be present. Okay, so flexor carpi radialis. Same idea, medial epicondyle of the humerus. It's going to insert at the base of the 2nd and 3rd metacarpals. What else can it do but flex the wrist? It also, because we're closer, right? You got the 2 phalanges, right? The index and the middle phalange. So it's pulling a little bit toward the radius. Right? It's the radial. It's inserting, it's crossing the radius. It's starting on the inside, on the ulnar side, but it's crossing and therefore not simply flexing, but adducting the wrist. Okay? Right. So what do they say here? They say flexor carpi radialis and extensor carpi radialis function together to abduct the wrist.
And radial deviation.
Well, that's what abduction is. It's another term for, and no, start to the best ability you can. Use the terms interchangeably, because that's the way you'll see them. Okay? Extensor digitorum, how far do I want to go? You know what, that's getting really into the fingers. We have to have something to do next week. Let's finish the pizza, go downstairs. I don't think it's necessary for me to continue this. I mean, it's not critical that we continue this now. I'd rather get you on the tables. How many people do we have tonight?
13, I think.
We have an odd number, then I may get on the table for, a little bit. I want to see what your hands feel like, for goodness sake. It's about time.
The hot stone protocol, I don't have one, and I was looking.
Remind me, I can email it to you.
Okay.
I don't know. Her hot stone I've got so many different hot stone protocols.
What? I need
last
her.
night, so you must not.
Yeah, I know.
Ew,
no.
that's why I was looking over there, to find,
It's
try to
not there?
find. Well, I kind of just looked a little, I didn't really look.
Remind me if you think of it, send me a text or, and I'll go into my files and see if I can send it to you. It's easier, you don't have to print it out if I send it to you. Okay. Let's